So in this episode, I interviewed Dr. Scott Rousseau, and I learned a lot about orthopedic surgery and the orthopedic industry, but also I learned a lot about something that we don't always talk about, which is how do you prepare for surgery and how do you recover for surgery? I think we talk so much about the surgery itself, or we think so much about the surgery itself, that we oftentimes overlook that what you do before and after could almost be even more important to your recovery or survival than the actual surgery itself. So enjoy this episode. I thought it was great insight. I learned a lot. Hopefully you learned a lot as well. Who is Dr. Scott
Yeah,
and how
so
did he get to where he is today?
yeah, that's a good question. So I grew up in outside Detroit in St. Clair Shores, community of about 100,000. And from school there, I went to Michigan State undergrad and finished in 1979, so quite a while ago. With a degree in chemistry. From there, I went to Wayne State's med school, and from med school, I went to Grand Rapids to do my orthopedic residency. After 5 years in Grand Rapids, I took a fellowship at Southern Illinois University in Springfield in spine surgery. And from there, I came back. I joined two gentlemen, very good general orthopedists, with a mission to form a spine program. So to have a spine center of excellence, where we had, and we did. After 2 years of being in general practice and doing spine, I formed the Spine Center of West Michigan. So that was my first voyage into practice and practice management on my own. And it was a multidisciplinary program. So we had consultants in all aspects of orthopedics, neurosurgery, pain management. So we were integrating a lot of different medical disciplines, rheumatology, physical medicine, rehabilitation, and then we had a rehab side. So we had a physical therapy, occupational therapy, work conditioning. So really, the whole person management as it related to orthopedic conditions and spine related disorders. And so after 8 years in that, I grew that. My brother Randy came and joined me as a physical medicine doctor. We had different consultants come in. We then merged with another group, so that the spine center kind of went away and became another group. So now a little bit bigger group of orthopedists and physical medicine doctors, called orthopedic and spine specialists. And we did that for 5 years till another group came and invited us to join them. They were bigger and they needed more spine coverage. And so with that group, we became Orthopedic Associates of Michigan. So a group of 35 or 30 surgeons or non-surgeons, um, about 20 physical therapists, and other services, total of, yeah, so we had 450 employees, so a big practice. So what you're talking, we had a lot of technology involved in the group and from that standpoint. And then after I was there for almost 20 years with that group and just retired last year and started a small practice, a startup. I have a nutrition company called Nutrifuel Nutrition that has a surgical supplement kit that prepares patients for surgery nutritionally, kind of fills in the nutritional gaps, but that complements the Recover Health practice, which is where I take people who need orthopedic surgery and prepare them for surgery, like especially seniors, uh, bigger spine surgeries, total joint replacement, or people that are having gastrointestinal, not just orthopedic, but gastrointestinal surgery. So we prepare them mentally. So we increase their resilience, their mindfulness, a lot of Eastern arts applied in there. Also some professional coaching where we teach them how to use their morning and evenings in a more holistic and healthy manner. And we also do then nutritional optimization. So we kind of drill down into what they're doing now. Many people are obese in our society, unfortunately. And our
Mm.
goal is to help improve their weight, but more importantly, they're in charge of their health, right? The first thing we do is we help them find their purpose for having surgery and their purpose for getting healthy. And that why drives their behavior. And then it becomes sustainable. And so we also have a physical optimization component of that. So where I train them, myself, using online techniques, physically, just simple things through walking programs, biking programs, strength training programs, all done in a very inexpensive manner. And then we have an online support series of modules that support them behaviorally, nutritionally, with visualization, yoga therapy videos, things of that nature. So that's where we're at right now. That's my story. That's where I am now after almost 35 years of being in practice.
And that was kind of my first question I wanted to ask you, because the whole point of Recover Health is to prepare people for surgery and recovery. But like, what if I had to go into surgery? I know it's a little bit general, but if I had to go into surgery tomorrow, like how would I prepare myself mentally and physically for that, especially if I'm older?
So if you were doing it and you had one day to prepare, it's not possible.
Okay,
So what
I
we
had like a
should be
couple
doing,
months. Like,
what we should be doing, no, I mean, but I think that's a very important point because nobody's anticipating, even young people, right? Young men like you're not,
yeah,
you're bulletproof and invulnerable.
yeah,
And that's
yeah. I
not
definitely
the
feel
case,
that.
right? You're not the case.
Even
And
like with insurance, like some people don't even have insurance. Like, I don't need it. I'm 20.
right,
Like,
they've got car insurance, so they're catastrophic, they're covered there. But what happens if they fall off a ladder trimming the trees
yes.
at their house, right?
Yeah.
So the point of it is that you should start preparing for surgery before you ever need surgery. You should start preparing for a healthy lifestyle before you ever get sick.
Mm,
Way you're less in the likelihood of you getting sick. So and that's what we do. We guide people, even young people who have, say, they have other health issues, GI issues, Crohn's, other things, helping them change their diet, helping them change their mindset, learning how to breathe mindfully, lower their stress level, lower their serum cortisol, all those hormones that are
mm,
stress, and learn how to take. So, but in answer to your question, if you had 2 months to prepare for surgery, you need somebody to guide you, like our program at Recover Health. You need somebody to help understand who you are, where you are health wise, and where you want to go after your surgery. What is it you're trying to accomplish? Are you having cancer surgery and your goal is to live? Okay, well, let's talk about how do we strengthen your mind? How do we teach you how to visualize health? How do we help you motivate yourself to do those things like changing your diet, starting a walking program, simple steps, small micro goals, simple steps. Now you start to see your body feeling stronger. You're lifting light weights, but you're lifting them every day. You're sleeping better, right? You're getting the negativity out of your mind because there is a lot of stress in our world these days. So
mm,
those are the things that a program like ours does, and we start that day one. Simple
mm,
steps, critical, with the goal having a very successful surgical outcome, right? A really positive surgical experience, but also having those behaviors that go on for years afterwards to continue your journey to your best health, your best life.
mm. And then that's kind of more of like the mental aspect. What about the physical aspect of it? I should be losing weight for 2 months
If
or
you need to lose weight, if you don't, maybe you're somebody who doesn't, maybe your BMI is under 8.5 or 18.5, so you're really
mm,
slender. So now we want to build you up with appropriate protein, healthy protein, fish, chicken, and beef, right? Things of that nature, the right vegetables, non-starchy carbohydrates, right? And combine that with a physical training program. So where you're lifting weights. So you typically tell people let's fuel with 30, 35 grams of protein right after you do your 30 to 60 minutes after your weight training session, just to fuel those muscles for maximum growth.
mm,
So those are simple things that you can do. So those are the things. The mind drives the behavior though. That's the
yes.
real thing. If your mind is negative, you're not focused on getting healthy, you're off thinking about everything else, scrolling through Twitter and those different feeds, LinkedIn for many hours, then you're not helping yourself. So you have to assume responsibility for the direction that you want your care to go.
Do you have a trick to make patients do that? Would you say?
You sit down and you listen to them, and you ask the questions to understand how they got to where they are right now. And once you start to ask those questions and you find out their why for illness, then you can redirect them to a why for better health.
Mm,
Understand me, you have to listen to them, and most physicians don't have the time. I mean, you're a busy family practice, busy surgical practice. You don't have the time, or maybe you don't take the time. I mean, it's everybody's perspective is a little different to find out what those patients truly need.
well, one of my questions I like to ask doctors on the show, specifically practice like those that are practicing in a hospital, is what's their thoughts on like RVUs, like relative value units, like your 15 minutes to achieve your RVU. It's kind of like a controversial question.
No, I never let the money drive my behavior, right?
Mm,
So, um, I think if you'll be a successful surgeon, a successful doctor, not to say that there's not financial pressures and it's not getting any easier. And the government needs to look at that and really fine tune how we do things. But I think you have to take the amount of time you need to to really learn what the patient's issues are, right? Sometimes, and that's why we have very successful advanced practice providers who are helping us fill in that gap. But I'll give you a story. I had a patient. I was going in and looked at the patient's x-rays, had talked to the resident before, had a real good idea what was wrong with the patient, walked in and started telling the patient exactly what's wrong. And he gave me an educational lesson. He looked at me and said, "Doctor, hold on. You're not hearing me." And so I had to step back and take in what his concerns were, right? I knew what
Mm,
his problem was clinically and radiographically on the x-rays, MRI scan, but I didn't know how it was affecting him mentally and emotionally and physically, what his interpretation of the problem was. So we learn so much from our patients if we take time to listen to them.
mm. That's a fair point. You kind of alluded to some skepticism about the current U.S. healthcare system. Without maybe getting too political, like what are your thoughts on U.S. healthcare?
Well, I think I mean, I think we have a lot of resources we pour into healthcare. And I think if you're really a tertiary ill patient, I mean, game on America's, you're injured in a trauma, you've got a severe cancer, something serious, you know, we're the place to go. I think where we fall down as a society, I'm not going to blame it only on the healthcare system, right? In that respect, where we fall down as a society is that the individual doesn't take enough ownership, right? They put the responsibility to the doctor to tell them exactly what to do. And therefore, if the doctor tells them you take your high blood pressure medication, but if they don't feel like taking it one day, then they're not following the recommendations versus the patient saying, "Doc, what do I need to do to take charge of my life?" And when the
Mm,
patient does that, then the success is guaranteed in so many ways. So in terms of our healthcare system, I mean, I think it's challenging. I think we shouldn't spend money. In other words, we shouldn't have insurance for issues where let's say in the current healthcare plan, as I understand it, I've gone deep into it. But when I talk to my son who has insurance, he's part of his insurance covers the expense goes into covering female issues, and not that's not going to be an issue for him. So maybe we need to personalize the insurance a little bit different for like people who are less healthy, people that are smokers, people that use marijuana, drink heavily. Maybe we need to be more aware of the people who are working hard to stay healthy and those who are not taking responsibility for their health and using bad behaviors. I don't know how you get there. I mean, I'm not really thought about that because that's not my area of interest right now or expertise. But I think there's a lot of opportunity to fine tune healthcare and keep costs down, remove waste. I mean, that's important everywhere, but it's very expensive. Our healthcare system is very expensive to deliver care.
mm. Have you ever had bad experiences? I don't know if you handled claims directly when you were an orthopedic surgeon, but like, did you ever have like peer-to-peer review or any
All the
issues or
time.
anything?
Yeah. Yeah, my wife is a medical billing company. So, I hear the stories that she faces for her practitioners that she covers, right? So, and then when I was in practice, I mean, yeah, we would have peer to peer. And I think that you have to do a good job justifying the recommendations you make for treatment, right? I mean, I've had patients that have where I've done reviews of medical records for various insurance companies, and I've seen patients that have had 150 visits of physical therapy. I
Mm,
mean, just a godly number, 100 visits of massage therapy, the same person. It's just not good care. So we have to really be thoughtful about what good care looks like and at the same time, so evidence-based medicine, right? What we know, what the literature tells us, and what we see in the situation, that kind of thing. So,
mm. And do you have any interesting like stories, insurance stories you can share with me or
you mean in
anything
terms of,
top of mind?
um, well, I don't, not offhand. I mean, no. I mean, just that I've done some surgeries that have been over hundreds of thousands of dollars in the care of patients' spine, really big, large, complex surgeries. So it's not inexpensive. And
Mhm.
there's a lot of cost in it. We have to do everything in our power to, recognize that and to make sure that we give the right care to the right patient at the right time and the right location.
That's so interesting that your wife is in the insurance industry, well, claims industry. We're building a tool that is going to be like an AI insurance tool to help physicians of claims. So it can create like a transcript of your uh, conversation with your patient and then turn that into the claim for United or Blue Cross, et cetera, et cetera. And the goal would be to have some clinics run this and then have 100% claims not get denied. But then the issue is the insurance companies are actually further ahead. You go to a clinic and you offer them some AI solutions, they're very skeptical about it. Whereas
Mhm.
United, their tech team's already working on it. Like, and I think that the result will actually be claims getting denied. There'll be an increase potentially in the next couple of years.
So how
Like,
will you
what's
help
your thoughts
avoid
on that?
that? Yeah, how will you help avoid that?
Well, if United and Blue Cross had an AI agent that's job was to look for mistakes, the only option is the clinic needs an AI agent that is trying to stop mistakes, and that's just the reality of it. If the medical industry doesn't catch up, it's going to result in more denials,
But
most
what does a
likely.
mistake look like? That's the question. So what are you categorizing as mistakes?
It would have to be not necessarily a physician error, but like an error from the admin team not billing something correctly or messing up a code or not classifying something correctly. I mean, I'm
And
speaking very
that does
generally,
happen.
but
Yeah. No,
yeah,
well,
yeah, yeah.
North American Spine Society recommends that physicians code their own cases, right? So
Mm,
for years we had coders do our cases. I mean, we would tell what the surgeon, they'd look at our reports and then they would code it and it would go out. But we had an episode in one of my practices where it was done terribly wrong for many claims, and on both ends, just and so a lot of denials happened, and so I think if you can do it right out the door the first time, that's a real plus. If you can gather all the necessary information for a particular diagnosis, right? So that if you're a physician seeing the patient and they know that they have to take out a herniated disc and they have an unstable slippage associated with that they're going to do a fusion operation on, then they have to have those codes that are relate to the decompression discectomy as well as the fusion procedure as well as the instrumentation procedure. And then you have to have the documentation to justify why you're doing what you're doing. So
mhm.
that's your challenge.
Well, the documentation will be done with like an AI note taker, an AI scribe, and it will take all that information and then uh, it would be smart enough to turn that into the claim, um,
Well, and
or
what
at
you'd want
least
to do is trigger for a particular diagnosis. You'd want to trigger the physician to make sure that he adds the correct, make sure that he does the right exam or adds the right things that fill in the boxes that will get the claim paid.
I can show you something later. I won't talk about on the podcast, but I do have something to show you after. I can show you after. It'll be cool. Oh, give me 1 second. So then, do you know anything about AI in healthcare, or is it something that you've been exposed to?
Not so much I mean, we use the Dragon One program for a bit, which is Microsoft's Scribe program, and
Yes, yes.
it was okay. It's very
It,
expensive, very expensive.
it's ancient at this point. I mean, there's so much other scribes that have come out. It's it's
But
like
but
pretty
yeah,
old.
I think AI is terrific for doing searches and getting achieving knowledge in areas that you're not sharp with. I use Open Evidence all the time, which is the
Mm.
Gamma program. Are you familiar with it?
I'm
It
not. What is open evidence?
Open Evidence is an AI tool where you punch in a clinical scenario and they'll give you feedback. It's I think it's the Journal of American Medical Association in association with maybe Harvard. I don't know. I might be wrong on
Hmm.
that, but yeah. So it gives you the ability it gives you a lot of good information and good resources. Then you go deeper into the subject you're concerned about, your patient issue, so to speak.
That could be kind of like seeing into the future a little bit. It could potentially kind of tell you some
I don't know what the
things.
future. I don't know what the future holds, right? I mean, I think having an avatar in a face to face with an avatar versus a face to face with a compassionate human might not win, but uh, but I'm sure somebody's going to try that. Anything to
Well,
keep calm.
what's your thoughts on telehealth in general? Are you
So I do it, right? Especially for patients that live 50 miles away in bad weather or 100 miles away or whatever. So I use it, but it's not the same as being like right there with them, where you can actually
Mm.
hold their hand in stressful situations. You can really see their facial expressions, their body language. So, and I think from my perspective, being in person is better than being telemedicine. But I think telemedicine has a place. And I hope the government continues to recognize that as a viable tool for managing patients, especially rural patients.
Yes, I was actually having a conversation with a physician about that yesterday. That it does look like it will no longer be covered. Correct? Like
No,
telehealth.
I think they just approved it till the end of the year.
Oh, but what happens when this year ends?
Well, hopefully they get wise enough and they when they come back to figure out how to balance the budget, which the government doesn't seem to have the ability to do. You and I would have to balance our budget, right? You and I, if we, the government has the ability to print money, which if you and I printed money to cover our debt, right, we'd go to jail. It's called counterfeiting. But so,
Yeah, it's only legal when the government does it, of course.
yeah. So, but I think, so I think telemedicine is a powerful tool and very beneficial.
Mm. So then, overall, to kind of wrap up this conversation, like especially with your startup in mind, like what is the future of U.S. healthcare look like to you?
Well, I think in our program, it would be we would see that every patient that's having a relatively large major surgery has multiple comorbidities, diabetes, obesity, depression, anxiety, general deconditioning, sarcopenia, frailty, all these different conditions. They would be able to see us, 8 to 12 weeks before surgery, and we get them going in our program that strengthens their mind, gets them focused, nutritionally starts to teach them how to optimize their nutritional intake, and then physically gives them just the very basic skills that they can take to the next level. So the motivation to train their bodies, the motivation to lower the stress by using mindfulness, and nutritionally fueling those cells, giving their metabolism, the best chance at helping them heal. We know that right now the stuff that we do, the prehabilitation, lowers hospital stays, it lowers complications in patients, lessens the likelihood of coming back to the emergency room, and lessens the likelihood of going to a rehab facility. So it gets patients home. We teach patients, I'll tell you, we teach patients how to build their social network, right? To really think about the team around them. We teach them how to handle their emotional state when they're going to the hospital and when they're coming home from the hospital. We help them plan for what happens after surgery. We answer a lot of the questions about the basic surgical experience when they're visiting with us. And so over and above, we complement what the surgeons do.
Mm,
And then Nutrafil,
awesome.
our nutrition company, we start that supplement kit 3 weeks beforehand. They go for 2 weeks. We hold it a week before because the hospitals wish us to hold supplements just for concerns over bleeding. And then we start it up when they come home. So they get a month's worth of supplements that touch on gut health, general health, bone health, immune health, and then about 6 months of vitamin D. We have liquid vitamin D that's well absorbed. So that's kind of build a whole comprehensive program around the patients and and their family. So we kind of make sure they're a team. They feel like they're covered.
Awesome. Well, thank you so much, Dr. Scott. I appreciate it.
My pleasure.